Disability Employment Awareness Month. My name is Jennifer Tenney, and I am the Program Manager for the Appalachian Regional WIPA project. Today I'd like to talk to you about a spotlight on employment, the Social Security Disability or SSDI work incentives. It's important to understand if you receive Social Security disability insurance that you get special work incentives for you to be able to go back to work if you'd like, to be able to keep some or all of your Social Security disability benefits and your Medicare without being affected um, by your work. So let's talk a little bit about that today. We want to talk about um, how that happens and uh, things that go along with working and keeping up benefits. But first, let's talk about how you become eligible for SSDI, or Social Security Disability Insurance. There are three ways that you can become eligible for Social Security Disability Insurance. The first way is as the disabled individual beneficiary, so the person who actually did the work. Social Security disability insurance is based on someone's past work history. So, like health insurance, car insurance, or life insurance, it is an insurance program designed to be there if you need it, but somebody has to pay into the system. So, as the disabled individual beneficiary, you would be the one paying into the system. The second way to be eligible for a Social Security disability insurance check is as a childhood disability beneficiary or a disabled adult child. Those terms are used interchangeably. This is a way to receive Social Security benefits if you have a parent who is deceased, retired, or receiving disability benefits of their own. As a childhood disability beneficiary, you can receive benefits for your entire lifetime. It does not stop at the age of 18. However, if you are receiving childhood disability benefits as an adult and you get married, you are no longer eligible for childhood disability benefits. The third way to be eligible for Social Security disability insurance benefits is as a disabled widow or widower, meaning that your spouse has passed away and you are eligible for their benefits. Okay. Like I said before, somebody had to do some work in order to be eligible for the benefits. So benefits range from $100 a month to really, there is no maximum amount. I've seen benefits up to $2,300 a month. It just depends on the type of work you've had before and what you've done since you started working. People who receive Social Security disability insurance receive Medicare after a 24-month wait. So you must wait 2 years from the date of your onset of your cash benefits in order to be eligible for Medicare. There are some work incentives that we will talk about here in just a few minutes. And the last thing that's important to know about Social Security disability insurance benefits is that when Social Security is looking at your benefits insofar as how much money you have earned, they look to see when you earned your money, not when it was paid. So they look to see what you made during a calendar month. So from the 1st of the month to the 30th or 31st, what did you make during that month? Okay. It's different for SSI, which we will discuss tomorrow. So tune in tomorrow if you want to know more about SSI. Okay, so we've talked a little bit about how you become eligible for SSDI benefits. So let's talk about SSDI work incentives. Okay. In order to be eligible for SSA benefits, SSDI benefits too, you have to have a disability that affects your daily living and is expected to last longer than 1 year or end in death, and it has to affect your ability to work and make what Social Security calls substantial gainful activity, or SGA. You'll hear me talk about SGA here in just a little bit. Those two things are what Social Security looks at once they determine whether or not you have what Social Security calls a Social Security level of disability. If you are receiving Social Security benefits, you have met that level. Now you are eligible for Social Security work incentives. These incentives are set in to allow people to work and keep some or all of their disability benefits for a set period of time while they are working. They're designed to help people try to work and engage in substantial gainful activity so that they can perhaps work themselves off of Social Security disability benefits. Okay, so let's get started with SSDI benefits. The first benefit that you receive when you start going back to work for the first time is called your trial work period. And it's exactly what it sounds like. It's a period of time that you try to work, and it is a 9-month period of time. So for 9 months, you can work and work absolutely as much as you want and make as much as you want without Social Security affecting your check at all. So you could make $5,000 a month and still get your SSDI check. Social Security does not care how much money you make during your trial work period. Those 9 months that you have for a trial work period are not necessarily consecutive. They are the first 9 months in a 5-year rolling window that you make more than the trial work period amount, which in 2023 is $1,050. That is an administrative number that Social Security uses to determine whether or not you have used a trial work month. So if you go back to work and you make $1,000 a month, you are not using a trial work period. But during the trial work period, we encourage you to try as much as you can, to work as much as you can, to see what your body will allow you to do while you are trying to work and make as much money as you can. That's the whole purpose of the trial work period, is to try to work as much as you can. So once we have those 9 months that you have worked and in 2023 made more than $1,050, Social Security starts what's called an extended period of eligibility. During your extended period of eligibility, that is a 36-month consecutive time frame during which Social Security says you can still make as much as you want. However, if you work and make more than substantial gainful activity, or SGA, which is always defined as a number, which in 2023 is $1,470, then you will not be eligible for your disability cash check for that month. When you are working on Social Security disability insurance and you are in your extended period of eligibility, the first month that you work and you are over substantial gainful activity, that is called your cessation month. You actually get to keep your benefits for your cessation month and a 2-month grace period that follows. After that, for every month that you are over substantial gainful activity, you will not get your disability cash benefit for that month. But if you are working and you go under substantial gainful activity for any reason at all, if you get sick at work, if you are hospitalized, if you quit, if you get fired, it doesn't matter at all what happens. Social Security just says, did you make more than substantial gainful activity, yes or no? If the answer is no, you immediately get your disability check back with no questions asked. That is during that 3-year consecutive extended period of eligibility. Now keep in mind that during your extended period of eligibility, that time runs whether you work or not. So it's really important to work during that extended period of eligibility so you're not losing any months of eligibility that you could be working. Community work incentive coordinators like myself around the country can help you when working to determine your break-even point, which is the point at which you would need to work and make enough money to be eligible to not get your disability cash benefit in order to make enough money so that not getting your cash benefit would be okay. We do that a lot, and that is what we're encouraging you to do, to try to work enough that you can work yourself off of benefits. However, we do understand that getting on benefits is hard, and if you choose not to work that much, then you can not work that much and stay on the disability rolls. Okay? So what happens after that 3 years? So you have 9 months, you can make as much as you want. After that 9 months, you have 3 years, you can still make as much as you want. However, if you're working and making more than substantial gainful activity, you're not getting your disability cash check for that month. If you're working outside of that 3-year time frame and you work over substantial gainful activity, you are technically terminated from the disability rolls, which means even if in the next month you are under substantial gainful activity, you will not get your disability cash check back like you did during your extended period of eligibility. During this 5-year time frame, if you have to decrease hours at work or stop working and it is due to your disability, then you can apply for what is called expedited reinstatement of benefits. What that does is it puts you at the front of the line for reapplication for benefits, where Social Security will review your medical chart and determine whether or not you meet the disability qualifications in order to get benefits again. So you have that safety net there if you need it, and it is 5 years after your end of your extended period of eligibility. So there's a lot of time that you have to work and have all these safety nets in place in order to be eligible for benefits. So what happens to Medicare? Some people may be wondering what happens to Medicare when you go to work with Social Security disability insurance and you've waited your 2 years for your Medicare, you have your medical insurance. What happens when you go to work? During your trial work period, you keep your Medicare, nothing happens at all. Once you start your extended period of eligibility, you are guaranteed an absolute minimum of 93 months or 7 years and 9 months of Medicare coverage, even if you are not eligible for Social Security disability cash benefits. So you will not lose your health insurance even if you lose your cash check for a minimum of 7 years and 9 months. That time frame can be longer dependent on whether you are terminated from benefits or not and when that happens. But you're guaranteed a minimum of 7 years and 9 months of Medicare coverage. So we want to keep in mind that working while on benefits is really beneficial to you. It will help bring you in more money, and there's lots of ways that you can work and keep some of your benefits or all of your benefits and keep your medical coverage during this time. There are other work incentives that you are eligible for also when you work on Social Security disability benefits. Two of those I'd like to talk about today. One is called the Impairment Related Work Expenses, or IRWEs. IRWEs are anything that you pay for during a month that you are working that you need for work. Things like medications, or eyeglasses, or assistive technologies that you pay for yourself. Any of those things can count as impairment-related work expenses. Even if you use those things 24 hours a day, Social Security's question is, do you need it to go to work? Or if you didn't have it, could you go to work? If the answer is no, then it could be potentially an impairment-related work expense. And for those on SSDI, this is how impairment-related work expenses help a person on SSDI. Impairment-related work expenses can reduce your total countable income and potentially bring you below substantial gainful activity even if you work above substantial gainful activity. For example, if you work and make $1,600, we know that that is above the $1,470 SGA limit for 2023. But if I spend $200 a month on medications, Social Security takes my $1,600 paycheck and subtracts my $200 in medication costs, which leaves me a total countable earned income of $1,400. That $1,400 is now less than $1,470, which means that I am now eligible for my disability cash benefit even though I actually made more than substantial gainful activity. And let me make a comment here that Social Security does look at your cash benefits in gross wages. So before tax wages. Everything they look at is before taxes. So what you make before your taxes. Okay? But impairment-related work expenses are a great way to bring down your countable income below substantial gainful activity in order for you to work above substantial gainful activity and still allow you to keep your cash check while you are working and trying to better yourself in the work world. Another way to work and have your check adjusted for total countable income is through what are called subsidies. And there are two different types of subsidies. One subsidy is where your employer allows you to work less than the time or the amount of effort that someone else in the office who has the same job title as you would do. The other subsidy is where an agency pays for someone to help you on the job, such as a job coach. And that job coach is with you on the job. So let me talk about the first one, where an agency allows you to work at a decreased rate as the same amount of a person who would be doing the same job as you. Let's give an example. Let's say we have a person who has deafness as a disability, and they are working as an administrative assistant in an office building. And one of the duties as the administrative assistant is to answer the phone. Well, a person with deafness as a disability would not be able to answer the phone without specialized equipment. And if that business did not have that specialized equipment in their office, then that person with deafness would potentially just not answer the telephone as part of their on-the-job duties. So if that person had 10 job duties and every other administrative secretary also had 10 job duties, and answering the phone was one of those job duties, then the person with deafness would have 10% of a subsidy, meaning that 10% of that person's work income would not count towards an SGA countable income decision. That is something that a community work incentives coordinator like myself can help you figure out when we're working with Social Security and your employer to determine how much of a subsidy that you may have. The other kind of subsidy, the special condition subsidy, is when an outside agency is providing you with help, such as a job coach. When you have a job coach, Social Security does not count that hour of work that you work when they are making a substantial gainful activity determination. So if you have a full-time job coach, Social Security will say that you made no money during that month, even if you made $1,000 that month. That's a very powerful job work incentive. If you are working and you have a job coach part-time, then Social Security will consider the hours that the job coach is on the job with you. They will not consider that time towards an SGA decision. If you have any questions regarding any of the topics that I have talked about today, please feel free to write them in the chat, and I will be discussing them during the Spotlight on Employment Calculus with the CWIC on October the 25th live. Or you may contact me at the Center for Excellence in Disabilities at 304-293-4692, extension 4. I'll be happy to help you out. Join me next Wednesday when we talk about SSI work incentives on our Spotlight on Employment. Thank you very much for your time. Have a great day.